of Indonesia. Mrs. Muti Siswati, time is yours.
Terima kasih. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Om Swastiastu, Namo Buddhaya, salam kebajikan, salam arsip. Yang kami hormati Gubernur Jawa Barat Bapak Ridwan Kamil, yang kami hormati para narasumber, Bapak Victorino Malano, Karen Chan, Liu Yun, Bapak Eka Yusuf Sinka, Your Excellency, my colleagues from SARBICA, hadirin undangan dan peserta webinar yang berbahagia. Pertama-tama dan yang paling utama, marilah kita panjatkan puji dan syukur kepada Tuhan Yang Maha Esa, di mana karena perkenannya kita dapat bersama-sama menghadiri acara webinar internasional Safeguarding the Archives, Memory, Pandemic, and Technology. Suatu kehormatan bagi Arsip Nasional Republik Indonesia menjadi tuan rumah dalam penyelenggaraan forum internasional yang dihadiri oleh sahabat-sahabat dari Arsip Nasional negara-negara di Asia Tenggara yang tergabung dalam Southeast Asian Branch of International Council on Archives, atau kita lebih mengenal lagi dengan SARBICA, yaitu Arsip Negara Malaysia, Arsip Negara Brunei Darussalam, Arsip Nasional Myanmar, Arsip Nasional Filipina, Arsip Nasional Kamboja, Arsip Nasional Vietnam, Arsip Nasional Thailand, Arsip Nasional Singapura, Arsip Nasional Laos, dan Arsip Nasional Republik Indonesia. Apresiasi yang sebesar-besarnya atas kehadiran para peserta dari Lembaga Kearsipan Provinsi, Kabupaten, dan Kota, Lembaga Kearsipan Perguruan Tinggi Negeri, BUMN, organisasi, dan perseorangan yang sangat antusias untuk menghadiri webinar internasional pada hari ini. Bapak Ibu hadirin yang berbahagia, webinar pada hari ini akan membahas arsip tentang penanganan COVID-19 yang merupakan sumber pengetahuan tidak ternilai dari generasi masa kini dan masa depan, khususnya dalam menghadapi pandemi yang akan terjadi di masa yang akan datang. Sejak ditetapkannya sebagai kedaruratan kesehatan melalui keputusan Presiden Republik Indonesia nomor 11 tahun 2020, pemerintah pusat dan pemerintah daerah telah menerbitkan serangkaian kebijakan yang luar biasa atau extraordinary dalam rangka penanganan COVID-19. Lembaga kearsipan menjadi garda terdepan dalam menyelamatkan semua rekaman kebijakan pemerintah ini. Dalam rangka mendukung cita-cita dan pelaksanaan Undang-Undang Kearsipan pada tahun 2020, Menteri Pendayagunaan Aparatur Negara dan Reformasi Birokrasi telah menerbitkan RB nomor 62 tahun 2020 tentang penyelamatan arsip penanganan COVID-19 dalam mendukung akuntabilitas kinerja instansi pemerintah juga sebagai warisan dokumenter dalam konteks pengurangan dan manajemen risiko bencana. Terdapat dua lembaga negara yang telah menyerahkan arsip penanganan COVID-19 di tahun 2020, yaitu Kementerian Kesehatan dan Perpustakaan Nasional Republik Indonesia. Selain itu, Arsip Nasional Republik Indonesia telah melaksanakan 9 kali wawancara lisan yang seluruhnya dilaksanakan secara tatap muka dalam rangka melengkapi khasanah tentang rekaman peristiwa penanganan COVID-19. Salah satu upaya pemerintah dalam menjadikan arsip pandemi COVID-19 sebagai sumber pengetahuan adalah melalui kegiatan penyebarluasan informasi arsip tersebut kepada masyarakat, seperti yang akan dilaksanakan oleh pemerintah Provinsi Jawa Barat dan Arsip Nasional Republik Indonesia dalam membangun pusat studi dan galeri arsip pandemi COVID-19. Bapak Ibu hadirin yang berbahagia, berbagai upaya dilakukan dalam rangka penyelamatan arsip pandemi COVID-19, termasuk di tingkat regional, seperti penyelenggaraan Asean Pandemic Response Archives (APARA) yang digerakkan melalui forum SARBICA. Inisiasi yang terinspirasi oleh arsip Tsunami Samudra Hindia ini telah berhasil menciptakan forum yang saling memberikan inspirasi antara negara-negara di Asia Tenggara, khususnya dalam pendokumentasian arsip COVID-19 di masing-masing negara, serta peran dan aktivitas yang dilakukan Arsip Nasional di masa pandemi, baik sebagai lembaga kearsipan ataupun lembaga pemerintah. Salah satu negara yang dapat menjadi contoh dalam pelestarian arsip pandemi COVID-19 adalah Republik Rakyat Tiongkok. Sebagai pusat epicentrum awal pandemi, Tiongkok memiliki pengalaman yang luar biasa, khususnya dalam pendokumentasian arsip penanganan COVID-19 secara nasional yang dikoordinasikan oleh National Archives Administration of China, NAAC. Bapak Ibu yang kami hormati, para peserta webinar, terima kasih juga kami sampaikan kepada seluruh panitia yang telah bekerja keras menyelenggarakan kegiatan ini serta dukungan dari Sekretariat SARBICA. Kami juga berharap kegiatan ini tidak hanya berhenti pada seminar ini, namun diharapkan menghasilkan satu rekomendasi yang dapat memajukan kesadaran pentingnya penanganan arsip-arsip COVID-19 sebagai memori kolektif, tidak hanya di satu negara, tetapi di seluruh negara Asia Tenggara. Akhirnya, saya ucapkan selamat mengikuti webinar ini dan semoga pandemi COVID-19 segera berlalu. Terima kasih. Wassalamualaikum warahmatullahi wabarakatuh. Om Santi Santi.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you, Mrs. Muti Siswati. Ladies and gentlemen, the next agenda, keynote speech by Governor of West Java. Mr. Ridwan Kamil, time is yours.
Let's start with first about West Java. West Java is the biggest province in Indonesia. We have almost 50 million people. Indonesia populations are experiencing many development issues, but so far we're doing okay. Development index increasing, environmental quality also increasing. Economic, we are recovered from minus in 2020 to 6.13 in a positive last quarter. If you see the next slide, we will see now we are enjoying our decreasing situation in West Java, down from the peak in the month of July, from the record 57,000 monthly average in the month of July to 427 in the month of November. Our hospital bed occupancy rate also down from 91%. Now in 5 zones in West Java, it's already down some to 0.9%. It means we are under control. Basic strategy, we have a prevention strategy, test and tracing strategy, enforcement, and of the health facilities also. And we have a 5 principles on how to fight COVID in West Java. We have been proactive. Yeah, we do not wait instruction from the central government. We always come forward to do what we think it is important. Second, we are very transparent, reporting to public about our data on everything, and we always try to be scientific to make a decision. We have many experts as an advisor to our government. Number 4, we mobilizing industry to be more innovative. to produce things that we need to fight COVID. And number 5, a spirit of collaboration, collaborative value is strength of West Java in fighting COVID. Many strategies, including restriction for social activities. We have 5 levels, from level 5 to level 1. We have also certain type of isolation center. For example, we have recovery center, means people who are about to recover from hospital, we move it to hotels, because then the hospital we can allocate to the urgent patients. In the rural area, we have what we call village isolation center that handle the patients in the rural area. And we have also a West Java vaccination center everywhere in the province of West Java, from centralized vaccine to mobile vaccine in rural area. And during the crisis in the month of July, we have what we call oxygen center. We send the oxygen to all the needed ones through our oxygen center in many zones. So this is how we create a system to make sure the urgent patient can have oxygen in hand as soon as possible. And on the economic side, we have also the social safety net program in the form of cash transfer and form of daily foods transfers. To handle the information, we have an apps, award-winning apps. We have 32 features. So everything but COVID will be handled from one application called People Bank. And we won many awards for this one. Yeah. From data, daily data, Q&A, registering for volunteers, asking for vitamin, medicine, asking for oxygen, and many more. 32 issues we handle within one application. And in the economic recovery, we have more or less 3 steps: rescue steps, number 2 recovery step, and number 3 is normalization steps. And I think we are on the right track. And also the COVID created what we call the increase of digital use in our society. So we created so many applications to make sure communication with the government and the people is becoming faster using the digital data. So to conclude, our background of saving this archive is because number 1, everybody, all the government are asked to save the archive of COVID history. Number 2 also is because this is health emergency in the national level. And also number 3, we are one of the pandemic epicenter. And number 4, we also created the terms for adaptation of new habits instead of new normal. And we are also very proud to be the center for vaccine production in West Java. So some time ago, we had an MOU between National Archive and our province regarding that West Java was chosen to be the main region that all the history of COVID will contribute to the ANRI or our archive, National Archive process in Jakarta. We have 6 focus about the historical date, about the locus locations on COVID situations, the issues of actions, the issues of data or figure, the issues of tools, and also the document of handling COVID. We are building also a museum of COVID in Bandung. This is a sample in Wuhan. So next one in our archive office in West Java, we also we are starting to design a museum for this COVID history. And next one, last one, West Java is the only province in Indonesia to create a monument for COVID heroes because we lost about 300 doctors and medical support person died because of COVID. So we would like to dedicate this monument to mark our history in our society and give respect to our COVID heroes. So I think these are the reasons why Indonesian government chose West Java as a main region for saving the historical archive regarding the COVID pandemic in Indonesia. For that, I conclude my speech. Thank you for listening, and hopefully you have a fruitful result from this conversation. Thank you very much.
Thank you, Mr. Ridwan Kamil. Excellencies, distinguished guests, participants, ladies and gentlemen. Our event continues with the agenda of discussion by the research person that will present their topic. First, we have Mr. Victorino Emanalo with a theme of Asean Pandemic Response Archive Initiative, followed by Mrs. Karen Chan, who will present about preservation and access on audiovisual archive in the midst of pandemic. Next, discussion about preserving memory and enlightening the future by Ms. Liu Yun. And the last, Mr. Eka Yusuf Singka, that will present about documenting response to the COVID-19 pandemic in Indonesia. As the leader of the panel discussion, I would like to invite the moderator, Director of Archival Education and Training Center of the National Archive of the Republic of Indonesia, Mrs. Desi Pratiwi. Please welcome Mrs. Desi Pratiwi. Good afternoon, Mrs. Desi Pratiwi. How are you today?
I'm fine, thank you.
So, Mrs. Desi Pratiwi, our next agenda is panel discussion, which of course the participant is waiting for. So, Mrs. Desi Pratiwi, take your time.
Thank you very much, Berly. Good afternoon, ladies and gentlemen. Hello, distinguished participants. Welcome to the second day of the SARBICA International Seminar. Today, it's all about how the COVID-19 pandemic affect records and archive management, as well as documentation for the benefit of future memory for generations to come. Just a little housekeeping before we get started to ensure you can interact with the speakers. Firstly, as an attendee, if you wish to ask the presenters a question, you should click Q&A icon at the bottom of the pane. Type your question into the question box in your Zoom control panel. Don't forget to write down who your question is addressed to. We will bring them up at the end of our presentations. In the day 2 of webinar, 4 speakers will deliver materials related to the topic archives and pandemic response. We realize that the impact of COVID-19 is far-reaching across the breadth of archive sectors that represent a risk to archival heritage, which in effect threatens an essential resource for upholding democratic principles dependent on transparency, scrutiny, and accountability. We are trying to minimize the overall impact of COVID-19 on the archive sectors, which increases the risk to archives collection so that future generations can inherit the information that exists today. Without any further delay, allow me to present our speakers. I'm glad to welcome Mr. Victorino Mapamanalo as the first speaker. He is the Executive Director of the National Archives of the Philippines. Mr. Manalo previously worked at UNESCO's Bangkok office and Beijing office. Hello, Mr. Manalo.
Hello.
Time is
No, I didn't
you?
work. I want to correct that. I didn't work in the office. I did programs with them. No,
Okay.
I did programs. I did not work in the office itself.
Okay.
Yeah.
Mr. Manalo. So time is yours.
Desi Pratwi. Can you hear me? Can you hear me talk?
Yes, it's clear.
Okay,
Very
good.
clear.
Okay. So I think we have to share my my presentation.
Okay.
So permission.
Please, the committee have to present.
Please share my. Okay. So I'm speaking about the ASEAN Pandemic Response Archives Initiative, or APARA. APARA, no? The name is APARA. And this is a program to archive documents that are related to the pandemic. Specifically, we are concentrating on government records. No, that, like, for example, the guidelines, the orders on the quarantine, the guidelines on how to do social distancing and everything like that. We are collecting the records related to that. No, so I will talk about it in a little while. Here's my overview of my talk. Okay, you can just take a quick look at it. So there are about 7 sections in my talk. Oh, by the way, before I continue, let me just thank again our host, the Indonesian ANRI, and the Indonesian Archives, headed by their director, Mr. Inang Gunarto. And of course, I'd like to thank also the deputy director who spoke earlier, Miss Multi Siswati, and my other panelists, Karen Chan, Wang Zhaozong, and of course the Secretary General of the Ministry of Health. Next slide. So this really, very obviously, this is coming out of the pandemic that affects all of us. No? Next slide. And our key, we focus really on 2019 as a start of, 2020 as a start of point. This is related to the initiative of UNESCO, that the idea of turning threats into opportunities. No, the idea that partially because we are all working from home, we are quarantined, partially because it is a historic event. The pandemic, though very sad, is a historic event that affects all of us. It's a world event. No, it's a chance to really document. No, it's going to be something that the world will look back on and think about and discuss for many years. So it's important that we collect the records related to this. So UNESCO pointed it out to us, and it's something that we also were thinking for some time already, that archives will have a role in the time of pandemic, because we can take care of the records related to the pandemic so that future generations can learn from our experiences. No? Next slide. Next slide. So the inspiration was really, I'm sorry, the picture is a little dramatic, no? But the inspiration was really the ASEAN of the APARA, of our response archive, is modeled after the archive of our own host today, the Indonesian archives, which set up after the disaster of the Indian Ocean tsunami. It set up the Indian Ocean archives, tsunami archives in Indonesia. So you see, there was a very sad event, the tragic event, the tsunami, I think of 2004, was it 2004? But out of that experience, they took out, Indonesia made something they did something historic. They made something that people can use for the future. They made something dynamic out of it. No, they built an archive. They collected an archive, put together an archive of materials related to the tsunami. So out of something tragic, they made something inspiring. No? So that was our inspiration for this APARA, or Pandemic Response Archives for ASEAN. Next slide. So the APARA initiative really collects, it's really a way of simply linking all the archives of the ASEAN, and asking each of the archives to begin collecting the records related to the pandemic, concentrating on government records related to the pandemic. But you will see later on that the different archives have different ways of going about this, about collecting the material for the pandemic. One of them, for example, Singapore is very advanced. They've already started collecting posters, materials, and also making oral narratives of making recording the stories of people involved in the pandemic. So they collected all kinds of materials. So it's already, what they're doing is quite broad, no? Whereas other archives, like the Philippines, were concentrating on government records, no? And we're all just starting. Some of us are just beginning to put together the archives. After all, it's been 1 year now. It's been just more than 1 year. So we're really concentrating on the beginning of the declaration of the pandemic in March 2020, all the way to the present, no? So the different records that came out from government regarding the pandemic. So this will form the collective memory of ASEAN regarding this event. But of course, we don't want to limit archives to just the government records. It's the choice of all the archives what they want to document. And also, even though you're not an official ASEAN archive, or you're not the government archive of the country, private groups, other archives can also go ahead and are, of course, free to go ahead and collect their own records. In some cases, we simply link with them so that what they collect complements what we collect. Next slide. So I was just saying earlier that not all of us are in the same place. Some are very much ahead, collecting a lot of materials, not just government records. Some of us are just beginning to document to collect documents that are specifically focused on government records. Next slide. Next slide. So the sample collections, no? Next, back please, back by one slide. You're ahead. So you can see that Singapore especially is collecting government guidelines. I'm sorry, not Singapore. All of us are collecting government guidelines, but Singapore is also doing posters. They're taking shots of web pages, all kinds of things, no? And they're collecting oral narratives or oral histories, no? They're asking people they're recording what people have gone through. And also they're doing photography drives, drives, so people can give in images of the archives of the pandemic and all kinds of other things. So there are so many ways to do it. No, next. Here are some of the examples of posters that Singapore is collecting. Please know, this is not the Philippine, or this is not APARA itself. This is Singapore, but hopefully we will be able to link it with the APARA website for ASEAN. Next slide. Next slide, please. So, when moving forward, as I said, we're just beginning, and we're just fixing the connectivity between the different archives, no? And we may have to help our sister archives on how to go about this as a way of providing technical assistance. But there are already some issues, no? Before I go into the issues, what we're really concentrating in, aside from getting all the different archives to begin collecting, we are trying to link them all in a web page to be hosted by our parent association, which is SARBICA. I'm sorry, I forgot to mention SARBICA earlier. SARBICA, of course, is excuse me, is the umbrella association for all the archives of Southeast Asia, and so SARBICA is coordinating all of this, the APARA initiative, the APARA project, and we hope to set up a web page in the APARA website, the SARBICA website dedicated to APARA. And this web page will contain links to all the different ASEAN archives. So some issues, no? Following the directive of the President of the International Committee on Archives, the President of ICA, no? We need to look into the idea of, are we collecting are we recording the experiences of the marginalized, no? Of those who have very little voice or no voice in our society? Do we make sure that because, for example, the Philippines is concentrating on government records? What about the experiences of those who have so much less, or those who are marginalized by society? Who will be collecting that? Hopefully, in our case, we will be able to work with private groups who can concentrate on this, or who will include this in what they're doing. And in fact, I think there are already private groups in the Philippines that are doing this. Just today, we had a presentation from Singapore, and it seems that they're also concentrating on the pandemic experiences of the marginalized. And one important vehicle for collecting the experiences of those who have very little access or no access to official records is the collecting of oral narratives or oral histories, no? The recording just the experiences, the pandemic-related experiences of people, especially of people on the street, of people who are marginalized or who have less resources. No? And we have to remember, even though we are collecting mostly, for example, we're concentrating on government records. There are many kinds of records that can still also give an idea of what governments are doing to record, to respond to the pandemic. No, so this could include posters, newspaper advertisements, and other kinds of related material. So not just official records. No? So that's something that we will have to work out. Maybe a private group can be the one collecting that. I think that's about it. What's this next slide? Was that the last slide? Okay.
Yes.
I just, to close my presentation, my brief presentation, you will notice that the name of the pandemic archive is APARA. The R there represents response. No, it is the Pandemic Response Archives, and this is the idea that we're not just talking about the despair, the sadness, the tragedy of the pandemic. We're talking about what we're trying to do about the pandemic. That's why we are concentrating on the idea of response. What people on in the grassroots, what people in the cities, what people in the government, what people in international organizations, what are we doing in response to the pandemic? No, so I think that's the most beautiful, the most important element. No? That's the human element that the whole world is facing this challenge, and we are trying our best to record for all time, for all history, for future generations what we have tried to do about what's going on. Thank you.
Thank you, Mr. Manalo. Thank you for the presentations about APARA that collect as much as our memories about the pandemic response, especially in the Southeast Asia regional. Our next speaker is Ms. Karen Chan. Ms. Chan is the president of CIFAFA. She has varied work experience in Singapore and New York. Hello, Ms. Chan. How are you today?
Hi, good afternoon.
Can you hear me?
Yes.
Yes. So please, time is yours.
Thank you. Allow me to just share my presentation.
Please.
Are you able to see?
Yes, now.
Okay. A very good afternoon to all our fellow panelists and participants of this session. I would like to just thank our host, the National Archives of the Republic of Indonesia, and also the distinguished members of the Executive Board of SARBICA. I'm very happy to be here and to be able to speak with you on this topic of preservation and access in AV archives. This is a difficult time for archives in general, for everybody. And I wanted to actually focus on sort of a concept of reimagining the archive. And I come with the double hatting of being president of CIPAVA and also the executive director of the Asian Film Archive based in Singapore. I would like to just start with putting out some of the key challenges that archives have been facing as a result of the pandemic. I don't think these are new to most of us. However, it is necessary to just have a quick look at what are some of the key items that I would speak about. And of course, this is not a conclusive list, and obviously there are many more challenges that every archive may face in our own sort of unique situations. So with the start of the pandemic and in 2020, a lot of our regular work environments have been upended and most of us had to work from home. However, conditions are not always functionable for many of us as archivists, and the inability of staff to access collections or equipment led to our operations grinding to a halt in many ways. I think the difficulty for us not being able to meet our stakeholders, our volunteers, our interns, or each other have made our work so much more tricky, much more challenging in more ways than others, right? But we've also looked at how users' access have been affected by in not being able to access our collections. And we've had to find ways in order to be able to engage with them and to be able to help them, access some of our materials again. And of course, this brings us all to the technological catch-up that we've had to embrace in accelerated form at all fronts, right from the archival component all the way to administration and I suppose things that we've taken for granted in many ways when we were all working within the office environment or within our labs. Right? A lot of us have had to learn and pick up IT know-how in record time. Some of us may be less technologically savvy, or those of us who are not born of the digital age may have had difficulty trying to catch up with what we've had to embrace within the home setting to just be able to work. We've had know-how that, or how to kind of costings. How do we transform in-person activities, for instance, into virtual events so that we can continue to put forth material or events and activities for the community that obviously would want us to continue engaging with them. And finally, there is the very, I suppose, important and rather serious notion also of the mental and social health of our staff who are really at risk by having been, isolated for so long in their own sort of environment and not having the ability to be able to work with their colleagues. Right? So in a way, we've had to plan ahead. And now we are adapting to what would be a pandemic sort of archive environment, but for the future, that we're preparing ourselves for an endemic sort of environment, that we have to live with COVID-19. And in many ways, some of these things that I've stated down here are really not unique to archives. They are things that city planners have adopted, business planners have adopted, so have our governments. And these are things that every organization, and in terms of their management, would have to look, what are some of the things we need to future-proof ourselves? So we're now looking at reassessing our risk management policies and strategies. How do we work if and when another pandemic hits us, right? So we do need to prepare for that, and we need to prepare our resources, our technological sort of infrastructures. We need to prepare our staff. We need to prepare our collections for that sort of a future that may involve many more pandemics, right? We need to harness the digitalization or the benefits of it to kind of enhance what it can offer, but also diminish the shortcomings that come with digitalization. It is not something that is, I suppose, I would say, built into an archive, right? It is something that we have had to adapt, and we are adapting at this point. But it is at an accelerated rate. Most of us have had to review things and think about how are we going to technologically sustain ourselves? How do we maintain and then keep up, or even prepare for the sort of the launch of technology that is speeding ahead, and that archives have to keep sort of abreast with this technological race. right? We need to find new ways to then engage with our staff and our stakeholders to help them understand why exactly are we doing, what are we doing, why are we doing what we're doing, and what exactly are we trying to achieve with something that we're embarking on in this manner. So there's a certain level of communication that we need to embrace, but we also need to be very clear in our goals. We can make mistakes, but we need to be able to identify them and be quite upfront to say that it is really something that we're treading into unknown territory, and we're in a way experimenting, but being clear that this is something that there is a goal that we're reaching and we're hoping to reach, and this is where we're working towards, right? So there needs to be a great deal of understanding and response to needs that kind of need to come together between staff, between stakeholders, between our funders. And there needs to be an understanding of where we're all heading towards. And this is where the collaboration comes in, the sharing comes in, and the learning needs to come in. It is not the time, and it is not time for us to be territorial or silo in our thinking. We need to really open up the way we work in order that each archive is able to survive for the future. This is not something that we can do on our own. And it is a common thread that you can see every government, every archive, every business owner, they're all thinking along those lines of having to work with each other. And I think I cannot stress this enough, that it is really something that all archives need to do and work together, much more than we've ever done, prior to or pre-pandemic. And this is where I come to having to think outside of the box. And this is where we must activate our imagination. But how exactly are we going to do this? And I'm just offering some building blocks for you to explore and to think about, to apply them where it is applicable, and to perhaps even innovate it where it would be applicable, to become applicable to your situation. I find that if we are able to establish something that is identifiable or recognizable to your archive, this helps people to identify your archive when that event comes around. So you could pick something that nobody else is doing, or somebody else, or you are doing, but doing it in a unique manner, and it becomes something that's recognizable to your archive, right? You can generate a project that allows you scope to innovate, and therefore to be able to grow the program and thereby making it recognizable for your own unique to your archive. And this third point is really about advocacy. In fact, all of these points here would eventually link back to the concept of advocacy, in that we can utilize the bountiful collections in our vaults, or create or develop or tease out an archival story that is appealing emotionally, something that is intergenerational in reaching the young to the old, and you could find angles to work it out for people so that they can identify with the archive, right? And this helps you to develop and grow a supportive community that will support you in a time of need. And when I say all of this leads into advocacy, I see it in this manner. When you advocate based on all those building blocks, you enable yourself to adopt, adapt, activate, develop, or educate. And these are keywords that are not new to all of us. We all do this in different ways. But I think we now need to pull them together in order to make everything cohesive and more, I suppose, linked in some ways that would enable us to engage with a wider community, that enables us to collaborate with other institutions, not just within your country, but not even within the region, but internationally, to develop networks outside of our industry, because this is where we need to work with our vendors, with different, I suppose, in industry professionals who support our archival industry, but may not necessarily work with us directly. This is the time for us to actually work with them in a more direct manner. We can influence what products come about. We can influence how much they support us, but we need to open the lines of communication, where we need to create opportunities that people can be involved with us as archives. For the longest time, archivists are generally behind the scenes. We always work the most comfortable behind the scenes, and we tend to work alone or maybe with your colleagues, but this is the time that you need to work with people. And I think once you adopt some of these various advocacy, I suppose, platforms, it will create that opportunity for you to venture into the wider community, to work with people and generate the conversations that are required in order for us to sustain our industry and to sustain the work while getting the support from the people who are our stakeholders, right? So whoever your stakeholders are, from the donors to the collectors to our filmmakers to the agencies that work with you, the private and the public agencies, and individuals who come to utilize your collections. These are all the people that we should be generating conversations with in order that they will support us throughout this journey and on beyond, right? So this is where I come to SIPAVA, and I'm very sure that many of you are familiar with SIPAVA. We have been around for 25 years. This is our 25th anniversary, and Henri is one of a long-time member of SIPAVA, and we're made up of, at this moment, 89 members from memory institutions across the board, broadcasters, universities, AV vendors, individuals and professionals, and they come from 24 different countries. And so we have actually broadened our membership base from just Southeast Asia and the Pacific to include and embrace a wider Asia. And this is an important sort of step, because really there is no room for us to be not working with our fellow archivists across borders and across boundaries. I do want to share some upcoming SIPAVA activities that actually showcase the points that I made earlier. We are going to be launching, or we have actually launched this publication. It will be produced and available in the upcoming months. It's called Keeping Memories, Cinema and Archiving in Asia Pacific, and it is edited by Professor Nick Ducampio in the Philippines. There are 18 essays here from film scholars, archivists, researchers, industry practitioners who have contributed towards a scholarship of discussing how important archiving is within the cinema industry. And there's very little material that sort of looks at the Asia-Pacific region as a whole. And we're hoping that with this publication that allows more study, more conversations again, and of course, more collaborations, I suppose, from archives who may not have known each other, or from professionals who would now be aware of the work of archives that they find out in this publication, and hopefully be able to work together in a more concrete manner right? And of course, we do have our annual SIPAVA General Assembly and Conference coming up in 2022. The dates will be announced soon on our website, and I hope that many of you, if not all of you, who are able to will join us. It will be a virtual conference, and we hope to be able to engage with you in a lot in a much better way, but also for you to be able to share your success stories, but also the challenges and the difficulties that you've had to go through, or maybe are still struggling with, because there will be people who, and fellow archives and archivists, who are going through the same thing and may have come upon and chanced upon solutions that they could share with you as well. And I think it's the sharing that makes us all a stronger institution, or stronger institutions generally, and enable us all to be able to sustain our industry. And of course, wearing my double hat as the executive director of the Asian Film Archive, I just wanted to let everybody who's attending know a little bit about what the archive does. We are a institution of the a subsidiary of the National Library Board of Singapore, and we're based in Singapore, but our collection spans Asia in general. And what we're hoping to do is to provide a home for films that do not find a home within their own country, or may not be archived anywhere else in the world. So eventually, what we're hoping is that our collection will be able to reach people, reach scholars and other, users, to be able to appreciate and enjoy the rich heritage of Asian cinema. So I just want to end with thank you again to our hosts and to SARBICA for organizing this conference. And I really hope that I'll be able to answer any questions later on, but feel free to also take down the SIPAVA's email address and my own contact if you would like to strike up some conversations. Right. Thank you very much.
I think you still in mute. Please unmute. Miss Liu, can you hear me? Could you please to unmute your...
你没用的产品吗？
Miss Liu, we still not hear you.
好吧，好，尊敬的维多利诺，马纳洛主席，尊敬的马尔蒂西斯瓦提副馆长，各位同事、女士们、先生们、朋友们，大家好！很高兴出席国际档案理事会东南亚地区分会2021年国际这个研讨会，感谢主办方的邀请。下面我围绕记录中国疫情这个响应这样一个主题，就中国档案工作在新冠疫情 这个期间在这样的举措和经验做一个简要的介绍。档案记录历史，服务现实，启迪未来，是人类实践活动的真实记录。中国档案部门非常重视突发公共卫生事件档案管理和开发利用工作。在新冠疫情这个肺炎疫情防控过程中，及时收集、整理防控工作相关文件材料，同时开展档案汇编和内容挖掘工作，为科学决策和突发事件的应对工作积累了经验，提供了参考。看见吗？好，提供了参考，逐渐形成了一套比较有效的突发公共卫生事件的档案管理要求这样的模式。第一，是将档案工作与疫情防控工作同步谋划、同步推进。中国国家档案局呢，负责全国档案事业的统筹规划和宏观管理和这个宏观管理，对中央和国家机关以及地方档案工作进行监督和指导。2020年2月7日印发的关于做好新冠这个病毒感染肺炎疫情防控期间档案工作的通知呢，我们提出了要求各级档案部门做好疫情防控期间档案收集、整理和利用工作，发挥好2003年非典这个等突发事件档案的这个经验借鉴作用。各地档案馆通过网络等方式持续对这个公众开放服务。各地区各部门，尤其是卫生健康部门，为抗疫工作这个开通了查阅档案的这样一个绿色通道，有效地支持了疫情防控工作的开展。比如说国家电网和中国建筑集团公司，还有中原国际工程有限公司，向武汉非常迅速地提供了2003年非典时期北京小汤山医院建设施工图纸这样的档案以及相关的资料，为10天内建成火神山医院，12天内建成了雷神山医院，助力武汉抗击疫情发挥了重要作用。2020年3月，国家有关部门转发了国家档案局关于做好新冠肺炎疫情防控档案工作的意见，要求各地区各部门将疫情防控档案工作与疫情防控工作同谋划、同部署、同推进，也同落实，实现了形成了这样的推进疫情防控档案的一个工作合力。要求各级档案主管部门切实的履行监督职责，加强对疫情防控档案工作的业务指导，协助同级应对这个新冠肺炎疫情工作领导小组这个指挥部进行疫情防控档案的管理，要求及时的收集、广泛征集疫情防控档案工作中形成的文字、图表，还有照片、录音、录像等各种形式的文件材料，做到了应收尽收、应归尽归。要求提前安排好疫情防控档案接收尽管工作，深入挖掘疫情防控档案信息资源，有效地发挥了疫情防控档案资政辅治的这样的作用。以上这2个文件材料重要的文件呢，成为了我们谋划部署、有力推动新冠肺炎疫情防控档案工作的一个重要的指导性文件。中国国家档案局重点从2个方面对文件实施呢开展了工作。一是建立在线疫情防控档案工作这样的群组，指导中央国家机关确定疫情防控文件材料归档范围和保管期限这样的要求，并且督促各单位适时的开展文件材料收集归档工作。二是 及时了解各地工作部署情况，指导31个省区市出台本地区疫情防控档案工作方案、文件材料归档范围和保管期限要求、档案征集要求等这样的文件，督促各地根据实际推进本地区疫情防控档案工作。第二呢，是进行管理制度研究和建设工作。在新冠肺炎疫情防控档案管理过程中，需要根据疫情防控工作的性质和特点，对档案管理制度进行完善和改进。对此呢，中国国家档案局主要做了3个方面的工作。第一方面呢，是启动突发事件档案管理战略研究。那么新冠肺炎疫情爆发伊始，中国国家档案局呢立即响应，组织专人专班，对重特大事件档案管理进行一个课题的研究，总结以往重特大事件档案管理中问题的难点，这其中的问题和难点，那么提出一系列的意见和建议，比如说我们健全机制和制度，建立信息平台等等。二是将突发事件档案管理内容写入法律。2020年6月20日，全国人大常委会审议通过的《中华人民共和国档案法》，对突发事件应对活动相关档案管理做出了明确的规定。要建立健全突发事件应对活动相关档案的收集、整理、保护还有利用工作这样的机制，使突发事件应对活动工作机制在中国成为了一项法定的要求。三是出台专门的规章规范突发事件档案管理，按照《中华人民共和国档案法》的要求和新冠肺炎疫情防控档案工作的要求，中国国家档案局于2020年11月12日发布了国家档案局令第16号，也就是《重大活动和突发事件档案管理办法》，界定了重大活动和突发事件档案的定义范围、各部门职责任务和档案管理要求，对建立重大活动和突发事件任务清单、提前介入机制以及专题数据库建设等做出了制度性的安排。在档案管理和档案资源的整合、开发利用和提供了这样的体系化的解决方案。第三，广泛收集新冠肺炎疫情防控档案资料。中国各级档案部门在日常收集档案范围以外，还通过了这样发布征集公告、接收社会捐赠，还有开展口述采集等方式，积极的拓展渠道，最大程度的留存疫情防控相关的这样的记忆资源。那么还有第一呢，我们是全面的做好档案收集接收工作，为了确保疫情防控档案得到完整收集和妥善的保管，各地档案馆普遍提前介入疫情防控的档案工作。那么通过派人参与档案整理、协助开展档案数字化等方式进行这样推进档案的进管工作。到今年年底，全国各级档案馆将全面完成2020年形成的疫情防控档案的目录的进管工作。二是加大开展档案征集，各地档案馆通过发布和定向推送征集启事，面向社会各界广泛的征集抗击疫情的档案资料。比如说浙江省宁波市开展了记录身边的战役随手拍作品征集活动，山东省青岛市 发起了以全民战役战役情为内容的向春天出发视频大赛专题征集活动。广东省广州市征集了100双援鄂医疗人员的手印等等，征集到的这个抗疫一线纪实视频、市民原创诗歌，还有篆刻这样的艺术作品等大量的珍贵档案资料。这些档案不仅记录了防控这个疫情的真实场景，也丰富了这个档案馆的馆藏。3是积极的推进口述档案的采集。南京、厦门等地这些档案馆呢，开展了援鄂医务工作者的这个口述历史采集工作，针对每位医务工作者呢，列出了不同的访问的提纲，详细的记录了医务工作者舍己为人、舍生忘死的这样的珍贵的记录。第3呢是实施疫情防控档案的国家记忆工程。经过1年多的努力，中国各级档案部门收集那个积累了大量的新冠肺炎疫情防控档案。如何将这些档案有效地归集起来，最大程度发挥档案的整体作用，全面开展疫情防控工作的这个全面的展现这疫情防控工作的历史面貌，成为了一项新的任务。最近中国国家档案局呢，以建设国家级专题档案记忆库这样为目标，印发了疫情防控档案归集工作方案。我们进一步的明确了疫情防控档案的收集、管理、保管、利用这样的要求。同时呢，我们也研究制定了疫情防控档案目录数据规范，提出了疫情防控档案目录的结构、格式，还有数据命名、存储要求等等。那么为各地按照统一的规范和标准推动疫情防控档案这个工作呢，提供了一个依据。我们计划呢，在未来的几年，持续的推进疫情防控档案的资源这样跨省、跨地区、跨区域、跨层级这样的一个整合，早日完成新冠肺炎疫情这个专题档案记忆库这样一个宏大的工程，为中国也为世界抗击疫情、留存记忆、启示未来呢，这个持续的贡献我们的力量。那么以上呢，是我对中国这个档案工作在新冠疫情这个方面呢一些经验和举措的一个介绍。谢谢大家的聆听。
Thank you very much, Ms. Liu, for your presentation. Ladies and gentlemen, our last speaker is Mr. Eka Yusuf Sinka. Mr. Eka is the Director of Center for Health Crisis, Ministry of Health of the Republic of Indonesia. He has a wide range of work experience in the healthcare field. Mr. Eka Yusuf Sinka, time is yours.
Thank you very much for the time. So for us all, I would like to give thanks and appreciation to SARBICA for this very important moment. And I would like to give the presentation. Let me share my presentation is about the documenting response. Documenting response to the COVID-19 pandemic in Indonesia. So what is the correlation between the response to the COVID-19 with the archive activity in Indonesia? So we can say here that the framework, our framework for of the strengthening emergency response is to fight about the existing condition in Indonesia to get the target that we are going to facing about. And this is our framework, and this is the example how the archive is going on in Indonesia, especially when the response to the COVID-19 pandemic in Indonesia is happening. This is the daily activity, daily reporting, daily archive regularly in Indonesia, how to deal with the COVID-19 implementation in Indonesia. And this is also the graph of the diagram of the situation COVID-19 from the confirmed cases, death, inpatient, and specimen examination, daily reporting, and this is archived in Indonesia also. And this is only the example how we deal with all of the airport and also some of the place in Indonesia. And this is the situation in our laboratory. And this is also the important thing is how we gain the archive of the natural disaster in Indonesia. So all of what we are doing is to be reported and come to the archive system in our Ministry of Health. And this is the example of our plan of action. I'm strengthening in the strengthening surveillance. Surveillance is regularly archived. This is a routine that should be implemented. How to use for the response for the health disaster, especially for the COVID-19. Let me come to our document about health crisis management. Let me come to the our health crisis management here. This will be documented as the part of the substantive archive in Indonesia. And this is the business of the Ministry of Health of Indonesia. And here, because my presentation is very much many, so come to here for the implementation stage. And this is for the category of archive from the health policy and the analysis of the health department determinant, health financing and insurance, and health supply, research and development, disease prevention and control. All of them is defined as substantive archive of related to the core business of the Ministry of Health. On the other hand, is the example of facilitate archive or COVID-19 archive related to the facilitating or supporting to the core business of the Ministry of Health, from the planning, international cooperation, law, public communication. And this is our report, a very short report, about how the archive is going on for the government of Indonesia, especially dealing with the response to the COVID-19 pandemic in Indonesia. All of the surveillance activity and also all of the policy activity is going in the archive activity also in Indonesia. Thank you very much. Can you see our presentation?
No.
But in my in my laptop, it is going on. Yeah, thank you very much.
Before that, I inform you that Ms. Liu is unable to continue joining the discussion. However, you can still ask question on the QA icon because Ms. Liu will answer directly on the icon. Is there any questions sharing by the committee?
I think there are questions in the question and answer. There are questions addressed to us in the question and answer box.
Yes, but our committee will collect and then choose which one will share.
Okay.
Please, this committee.
Okay, do I answer the question now?
Not yet, Mr. Manalo. Please.
Okay.
Waiting for our committee first. Hello, the committee. Please help me share the questions that you have already collected and choose. Hello. The question, please. The question that I can read for the presenter to be answered.
There's a question that's already on the screen.
Okay. I cannot see the screen.
Would you want me to read it?
It looks like we have the questions. Okay, I read the questions addressed to Mr. Victorino Mapamanato. I read the questions. When collecting archives about the COVID-19 pandemic, speed, accuracy, and thoroughness are needed in a situation that we can say is in a state of urgency and many disturbance. What are the challenges in collecting pandemic archives that say they are COVID pandemic archives? Does the collection of pandemic archives have certain criteria from the urgency? Is it important or just ordinary? Please.
Okay. I think when we're talking about pandemic archives, no, because it is the archives of a pandemic, there may seem to be an element of danger because, of course, a pandemic is dangerous. But in fact, the collecting of the records is something. The collecting of material for the archives is something that you can really control, and you can really decide what you will be collecting. So if you are collecting record, like in our case, the records of government agencies, it's a question of simply getting in touch with them, and then eventually the records should be forwarded to you. So there's really no element of danger there, or there's no element of having to catch the record at the right time. Well, you simply decide what to do. But in some cases, you may decide to collect material that was used like in public programs, or I don't know. I suppose if there's some kind of some artwork or things that reflect what people were thinking in terms of drawings, etc., then maybe it's a little more complicated, no? But otherwise, it's really up to each archive to decide what kind of records to collect, no? So Singapore, for example, from what I understand, is they collect all the web pages. Every day they take a snapshot of all the web pages, but they also interview people. And of course, there will be some safety issues, but you will have to handle that using health protocol. And they also collect artworks, no? So that's also in the case of the Philippine NGO, non-government organizations that are doing their private sector collection. They're also collecting based on their own criteria, but collecting in a way after the fact, no? So there's really no rush. Thank you.
Thank you, Mr. Manalo.
But perhaps the bigger issue is, as we said earlier, to make sure that the archives you collect are representative of the different sectors of society. And the bigger issue really is, how do you collect records or documents that reflect the experiences of the marginalized? Thank you.
Thank you, Mr. Manalo. I agree with you, because I think every country have a criteria to choose which one documentation in society have to collect in the archives. For the question, another question.
So this question is for Karen Chen.
Yes. Which one?
Can you see the screen?
Yes, I see the screen. And the question is how ASEAN can help in the continuing of educations of AV archivists, especially for the younger generation in the region. I think every archive has some kind of educational outreach. However, with AV archivists in general, we are quite lacking in this region, and I have to admit that, which is why I think SIPAVA, institutions like SARBICA, we are trying to collaborate with our sister organizations in larger sort of umbrella organizations like CCAAA, that stands for the Coordinating Council of Audiovisual Archivists or Archives. So this particular council is related to audiovisual only, right? But I think it's working with these kinds of umbrella sisters, organizations, that we're able to bring about more training, not just when we have annual conferences or when we have large events like these, but there have been archives who have been able to work with specific trainers that they got to know as a result of attending events such as these, to be able to organize training for their own institution. So I think it's when we network more, when we talk to each other more, that we find out that there are many people who are more than happy to help, more than happy to share their expertise. And this is where we all can learn. Just giving my own sort of experience as an AV archivist, I've been, in this business for about 20 odd years, but I learned everything on the job. I learned it through people, through the experiences of other more experienced archivists, and they have been very, very generous in sharing not just their experience, but their expertise and also resources. And right now, there are so many archives and associations that have put on online resources that you can utilize, that you can read up on. And of course, nothing beats a hands-on kind of learning, but it is still better than nothing. And it allows all of us a chance to really widen our training sort of horizons.
Thank you, Ms. Chan. Another question, please. I think another question addressed to Mr. Eka. The question from Octavia Safarwati. What are the challenges faced the Minister of Health of Indonesia in archiving the COVID documents, considering there are various Indonesian institutions involved in handling this pandemic?
Okay, thank you very much for the question. The challenge we are facing is about because of Indonesia is very huge and the archipelago, and we have a lot of so many provincial and also district level. So our facing is how to all the data, all the notes come as soon as possible. So we use the IT for this situation, and this is could be come to our Bureau for Archive in the Ministry of Health to be noted and to be archived. Thank you very much.
Thank you, Mr. Eka. Are there any questions? All right. Maybe due to time constraint, these 3 questions were chosen to represent the incoming questions. Thank you again for these interesting discussions. We have arrived at the end of the webinar. Before I wrap up the webinar, the speakers are welcome to deliver a short closing statement that may be of concern to all of us. Please, Mr. Manalo, it takes about 1 minute for you to deliver the closing statement.
It's important, I think, to realize that that even out of something tragic like the pandemic, something very difficult, we can still come up with something that will be a source of hope and enlightenment and learning for future generations, which is an art. We can document all the things that have happened in the pandemic, and preserve these documents, these records for future generations to be able to learn from our experience. Thank you.
Thank you, Mr. Manalo. Followed by Ms. Chan.
I just want to add on that I think we need to be brave and bold in moving forward as archivists. We need to be embracing the challenge. And I think that's where we will discover a chance to actually work with different people. There is a question that we didn't get to, or I didn't get to answer in the Q&A. I just wanted to quickly maybe point out an answer to this person who said that a lot of people don't get internet access, and how do we overcome something like that when we are putting things online? And it's true, the pandemic has shown us that inequitable side of things. But I think if we reimagine it, you use your imagination. Try working with the IT giants, for instance. They host all kinds of events in your communities. You can approach them to host events and sponsor events, and then channel your money towards something else that might be more pertinent and vital within your archive. And these are ways that you can reimagine. I hope that helps. Thank you.
Thank you, Ms. Chan. Mr. Eka, can you please deliver your closing statement?
Okay. Our opinion, archive is very important and very crucial. So It is tools, and it is also part of our surveillance activity, and for the public policy, especially for the implementing the policy on the public health implementation all over the world. Thank you very much.
Thank you, Mr. Eka. Great. Thank you for our speakers today. It was a pleasure being with you all in the webinar. Thank you very much, everyone, for your unvarying attention throughout these today's presentations. We appreciate you being here. Do not miss the third day webinar on digital transformation for records and archive management tomorrow. Thanks again for joining us today, and we will see you tomorrow. Please stay safe and keep healthy. I return to the MC to read the result of the second day webinar.
Bye-bye, Miss Karen Chen. Nice being with you.
Thank you.
Thank you, Mrs. Desi Prativi, for leading the panel discussion.
Thank you very much.
Thank you very much for all the speakers and presenters today.
Thank you, Berly, and I will return the event to you to continue.
Okay.
Thank you.
Ladies and gentlemen, once again, I will say thank you for Mrs. Desi Prativi for leading the panel session and discussion, and also thank you for all the speakers and presenters for delivering their knowledge in the conference. Ladies and gentlemen, let me invite Ms. Stella to deliver the recommendation for today's seminar. Ms. Stella, the time is yours.
Thank you, Ms. Berly. Good evening, ladies and gentlemen. I'm Stella from the National Archives of the Republic of Indonesia. Would like to deliver the recommendation. Our recommendation for today's webinar. So our recommendation on Pandemic Response Archive. The first, our recommendation is all parties, both government and non-government institutions, should build the Pandemic Response Archive as documentary heritage, including the society or community. And the second recommendation is we should optimize the ASEAN Pandemic Response Archive, APARA, as a center point for managing Pandemic Response Archive in Southeast Asia. The third recommendation, we should conduct the program of collecting, arranging, preserving, and providing access for Pandemic Response Archive as the documentary heritage. And the last, international archival organization should work in collaboration to determine the criteria of pandemic archive that will be kept at the National Archive as an international standard, including the technology used in managing the pandemic response archive. That are our recommendations. I'll return the event to Ms. Berly. Thank you.
Okay, thank you, Ms. Stella. And for the best questions are the winner is Julie Nelega, the first runner-up is Octavia Shafarwati, and the second runner-up is Sania Akila. Sincerely, congratulations. Congratulations for the winner of the best question. For more information about the prize, please contact the committee. Ladies and gentlemen, we are now officially at the end of the event. On behalf of organizing committee, we would like to say thank you for making time to join us today. Hopefully the knowledge that we have gained today can be useful for all of us. Good afternoon. Wassalamualaikum warahmatullahi wabarakatuh.